Hi, everyone. I'm Wendy Ingram. I'm one of the co-founders and the CEO of Dragonfly Mental Health. We are a worldwide global organization of academics, by academics, for academics, focused on cultivating excellent mental health among academics worldwide. And I am so pleased and excited to be here for this talk by one of our amazing members and team leads, organizational team lead, Olga here. And she is going to give a talk on mental health and isolation. And we really appreciate everyone who has come and might be popping in a little bit later as the hour moves on.
Okay, thank you so much. So yeah, basically we decided to organize a couple of talks during the Mental Health Awareness Week, and one of them is mental health and isolation, and it's been prepared together with Max Planck Society Mental Health Collective volunteers and the Dragonfly Mental Health Collective volunteers. So basically this is like a bunch of people who got together and made a talk on mental health and isolation. So before I start, I'd like to give you some disclaimers. First of all, I'm not a therapist and I'm not entitled to give any advices or anything. I'm a medical doctor, I have a PhD, but I am not practicing as a psychotherapist or psychiatrist. So on this, all the things that I'm talking about, they're more like general knowledge. I do not have kids and I live alone. I think it's important to say when we're talking about isolation, because I experienced firsthand some mental health issue with living alone, but of course it's absolutely different for people who have kids. We will touch on that today. However, I have not experienced this personally. And also very important to mention is that my boss is reasonable and you talk to him and you can talk to him and negotiate with him. And this, of course, has been one of the important things why my isolation time did not really suck that much, I have to say. So what is different now on top of everyone, especially in Germany, wearing masks? So first of all, actually, what I wanted to say is that, as I have already told a couple of times before in other talks, I was really, really hoping that this talk would be outdated and that we will not need this talk these days. It would have been so nice if we could just archive this talk and say, that's it. We gave it once in a while, but it's not necessary now. But no, unfortunately, it seems like the second wave of coming and already came to multiple places. And at some points, there were no even the end of the first wave. So we're still there. We're still in Corona times. So let's talk on what's different now from the pre-Corona times. So first of all, it's lack of physical contact with family members, friends, and colleagues. Some of us are working from home. Some of us, unfortunately, are temporarily unemployed. Those who work in wet lab, they have either stopped or reduced their research activities. And all these things together, they bring an uncertainty for the future, financially, health-wise, travels, other plans. Some of us have to homeschool the children. And of course, all these things, they cannot avoid, but they do impact our mental health. For some people, they're better off during lockdown, and some people are worse off during lockdown. So we are going to talk about those who are worse off, because better off are fine. So there have been already some studies on quarantine measures. And most of the publications say that there are negative psychological outcomes, such as depressive symptoms, anxiety, anger, stress, and so on and so forth. And overall, the conclusion is that, of course, quarantine measures during serious outbreaks have extensive negative consequences for the mental health. Some numbers, they were pretty interesting, still going on at a certain point, social study from London, and they have asked more than 90,000 responders on their physical and social experiences. So what I would like to say here is that, as we see here, during the first weeks of lockdown, depression is going up, but further on, our body and our mind seem to adapt. And also the Corona measures, this was for UK, seem to be like easing. Yeah, here you can see that. And then, so together with the adaptation and ease of measures, things were getting better for depression and anxiety. What is important here, I don't know which age groups of people are here, but I think this is very important graph for people who work with students. So for PhD coordinators and for postdocs and for group leaders, here we see that this depression as by age group, the kids from 19 to 29, they're the most affected. So this is our PhD students. They are here in this group and they're the most affected. So we really should give them a closer look and take care of them from this perspective, because they're the most affected group. So it goes the same for anxiety, goes the same for self-harm and thoughts of death. So unfortunately, while we're taking of ourselves, and of course this is extremely important, and we put the mask on ourselves, we also need to put a mask on our PhD students. However, things are not that bad. If you see here, especially if, at least from March to August, the things were getting better, as in with the life satisfaction, as I already said, that our brain adapts pretty well. And people, especially in the first world countries, are getting more used, and they're less worried that government will not be able to provide them with food or things like that. So at least people are less worried about financial and food situation. At least that was the case by the end of summer. I'm pretty sure that the curves are growing now with the second wave. Now, I would like to really give a closer look on what's happening to body and mind. So first of all, mental health is not different from physical health. So there are triggers affecting the mental health state, as there are some triggers which are affecting physical health. There are also, of course, some triggers which are affecting mental health. So it is crucial, it is essential and very important, I underline, to understand what is your anxiety response. And you have to learn how to manage the stimuli and make yourself less anxious. What is anxiety, basically? So as most of you, of course, know, there's parasympathetic nervous system, which is responsible for the taking control over body functions when there's a rest. And sympathetic is responsible during stress time. So basically, sympathetic system is responsible for our fight or flight response. When it happens in natural habitat, basically, when your body sees the tiger which is going to attack you, you see the acute stress. So you see the predator. The response for your body and your mind is known biologically and evolutionary. So so your body feels like it needs to do something right now. So sympathetic system switches on, and it's basically you get the fight or flight response. You either flight from predator or fight the predator. And that makes your sympathetic system to be switched on for a short time. So you'd get a possibility to get the fight or flight response. And then after the stress is gone, your sympathetic system is being taken over this signals by parasympathetic system. So what happens during the chronic stress, like COVID-19? The problem is that it's here all the time. It's with us, it's in the news, it's in the talks, it's in the discussions, it's everywhere. Your body feels like it's in a danger, in mind, it feels like they're in danger and you need to do something. And the natural way of doing something is fight or flight. But the problem is that neither flight nor fight is possible. So you cannot fight COVID, you cannot flight from COVID. There is no COVID-free space, and it makes your sympathetic system to be chronically on. And that's why you feel, or I feel, we all feel anxious and agitated permanently. And this is the major issue which causes your body to feel like, you know, something bad is going to happen. I need to do something. It is critical to manage the system. And how do we see what are actually symptoms of this chronic of sympathetic system being constantly on? Sleep is disturbed, which creates this nested feedback loop of like, you sleep less, you're more anxious. Then you sleep less, then you're more anxious. Then you sleep less, and so on and so forth. Also, emotional control is being impaired because of this. So you are feeling that you need to fight or flight. And of course, it will affect the people who are close by to you, your friends, your family members. Of course, they will be the first to fight or flight. Also, a lot of people report rumination. It's when your thought process about being caught in some loop of thinking about one thing, and you cannot stop thinking about it. And also the other problem is the loss of life structure. So basically, you used to get up at 8, leave to work at 9, be at work at 10, leave at 6, and have some sort of like life routine, which has been affected by COVID. Of course, this loss of life structure has been probably taken care of by the most, but we'll still talk about it a little bit. So what to do? You need to manage your environment to minimize anxiety triggers and maximize anti-anxiety experiences. Practically speaking, when we're talking about chronic sleep deprivation or something, you need to try to acknowledge this and feel that, yes, I am in this nasty feedback loop. So a lot of people are saying that guided relaxation is really helpful to them. Now, as I always say, I also have to mention it here, I come from former Soviet Union place. So guided relaxation and mindfulness technique were never a thing there. Never. No one even knows, or no one knew back then when I was growing up, that this thing even existed. So of course, you come from the place where it didn't exist or was mocked, sort of, yeah. And I was absolutely negative about this, completely negative. I was like, come on, like think in 10 minutes that you should relax. Like, will it help you to relax? This is ridiculous. But in fact, it's not ridiculous. And I tried it in the beginning of pandemic, and it actually really, really helps. The guided relaxation is one of the best things one can use. Plus, you can, of course, at certain point, when you start, it feels a bit not helpful or less helpful, but it's one of the things which are like really kicking in right away. And after a certain amount of training, you really, really feel much better during the and after guided relaxation. Of course, there are plenty YouTube videos and guidance which can help you to do this, because it's difficult to do it on your own without anything. So there are more spiritual ones and there are less spiritual ones. It is up to you to which one to choose. Regarding emotional control, which is impaired, so you really should tell yourself when you're isolated that you are doing something. So it's not that you're sitting at home aimlessly, it's actually you're sitting at home taking care of the elderly citizens who are at danger and who are at major risk nowadays. You are much more than helping medical doctors who are at the front line fighting COVID. So these are the things that you should tell yourself. Yes, I'm sitting at home and it feels like I'm just, watching Netflix or whatever it is, yeah? But I am actually doing something, and I'm helping the society and the members of society and the people nearby me to survive and to go through COVID. Rumination. There are not that many things. I mean, I have to say that also this is one of the things regarding the practicing guided relaxation can help with ruminating, but also it's important to understand that mind can only ruminate about one thing at a time. And during one of the training, we participated and we were given a task to describe a picture. So basically, I still remember it was very nice field with the poppy flowers. I think it's called like this red ones from which we get poppy seeds. And so if you feel that you're ruminating, you should have a look at one picture with the field or snow, whatever you like, and just start describing it. And then it will help your brain to switch from ruminating on one thing to get into the process of thinking about something else. And describing a picture with a nice view is something which helps. And you should try it. I think it's really nice, some sort of a shortcut. And with the loss of structures, you need to create new structures. For me, it was morning walks before work. So even though everything is closed, you still can go for a walk. You can go take a coffee cup to go, or just go for a walk, and so on and so forth. These are the things, small things, and we'll talk about new structures a bit further. Yeah. Also, what's important is to manage your news consumption. I think we also have managed, all of us more or less, to stop reading about COVID at certain point, but still it's really important to care and budget your news consumption maybe to 2-3 hours a day, and try not to watch the news within 2 hours of going to sleep. This is important, and otherwise you'll constantly be thinking about whatever is happening. I think one of the things which can help the sleep pattern is getting a natural light alarm clock for dark times, especially it helps with the waking up. And another thing is you should try to use a palate cleanser washing after news. So basically this comes from food tasting, I think, when they use palate cleanser in between different dishes. So I think we should use the same for the brain. For me, for example, it's watching some sitcoms, which I already know, which I watched a million times before. So for me, watching some sort of like brain palate cleanser helps to bring my sympathetic system a bit less active. Create a new schedule. Wake up at a specific time and go to bed at a specific time. Important, yes. Possible, I don't know. For some people, yes. For some people, no. But especially if you work from home every day, you really should try doing this, and it will help you to have more structure. Eat your meals at the same time, and of course, try to eat healthy food. This is nothing new. Yes, this was particularly difficult for me. To schedule weekdays separate from weekends. For me, it was nearly impossible because I wasn't, I'm still writing the paper, and you never know when the muse comes. She may come and visit you over Saturday evening. Then you have to sit and write. Extremely difficult. So this is a bit too optimistic for me, but I'm pretty sure that there are people who can do it. And again, morning walks before coffee, before work, and of course set a quality time to get to spend more time with your family, such as, especially like if you enjoy doing some things together, such as sports, watching comedy. A lot of people enjoy singing karaoke with their family, and basically all the aerobic activities or dance or whatever it is help a lot. Now, when I was preparing for this talk, I have asked a bunch of my colleagues with the kids, what do they do then if they have to work from home and they have to homeschool the kids? And one of the nice things which were suggested was that you have shifts, basically. You just make shifts with your partner. In the morning, you sit with the kids and your partner works, and vice versa in the afternoon. And then maybe some couple of hours after work, after 7 p.m. or something, to catch up with the things which you didn't manage to do. For single parents, it's much more difficult, of course. And the only suggestion, or the practical suggestion, which was there nearby around, is that you need to like team up with some other parents, and you can do the shifts with parents, with the single parents who also have the kids. Otherwise, it's extremely difficult because the kindergartens are closed, schools are closed, if it happens again, yeah? Then you either split the duties with your partner, or you team up with other parents. Otherwise, it's a nightmare. Yes, as we discussed, activities with kids. Now getting back to work, this seems a bit too optimistic for now, but still, this is an important thing which we have experienced in August here in Germany. It was very, very difficult that you don't go to work at all, and then suddenly your institute tells you, no, now you have to take care and show up 5 days at work out of like 5 working days. And we were like, are you absolutely crazy? This is virtually impossible to sit at home for 3 months and then start going to work every day. So when it was possible, we decided to agree that even though the rules are 5 days at work, we still try to manage to do it at least 3 days in the first couple of weeks. But here again, my boss is a very reasonable guy. So with him, he doesn't care much. So we managed to negotiate on these things. It was very nice. If you have or have had longer term mental health problem, you are entitled to reasonable adjustment. So you need to talk to your family doctor in Europe. I'm not sure how it is in the States, unfortunately. And in the States, it of course is probably much different and most likely much worse. But at least here in Europe, you are entitled to get to some easing and reasonable adjustments. You just need to talk to your family doctor. If you haven't feel like talking to your boss before about your mental issues, then I think maybe this is a reasonable time, if the boss is okay, to tell him or her or them that, you know, like, I will need time to adjust and it will take me some time. Getting professional help is always important to keep in mind that if you're struggling, it doesn't mean you should or you have to. If you're struggling, go talk to your family doctor, or try to find a therapist at your own by asking the community or simply Googling one. With the public insurance, especially here in Europe, you're entitled for several free of charge hours, and then you can decide with the therapist. If you're from Max Planck Society, please email me. I can guide you to the EMAP program. They have special offers. By the way, for people who are in the States, but they are still Max Planck, you are entitled to get this EMAP help. We should be able to, but at least we can figure it out. Alternatively, you can get online sessions with the therapist from your country, but you'll have to pay, but it will be on your own language. And you should keep in mind, you can always go to ER and ask them for help in case if you feel some sort of suicidality or something like this. Is there some question? Someone switched on the microphone. Okay. Yeah, please, if you feel that something bad is going to happen, if you're not sure if you're about to harm yourself, you can always go to ER, even if you don't speak the local language. Like, even if you don't speak German here in Germany, you go to ER, they will be able to help you. Another thing is to check out burnout clinics in your city. And of course, for the students, most universities offer help programs for students. So even if your local institute doesn't offer this help, you can always go to university and say, hey, I'm a student, I need help, and they should be able to help you as well. Another things you can do is socialize with other scientists independent on the scientific topic. For example, you can use Dragonfly Cafe, which happens 3 times a week in Dragonfly. And it's basically a casual chat about some mental health issues, or not necessarily about isolation, some tips and tricks. How to get therapists in Germany, we can cover it, but it's of course not only German oriented. And you can participate with video or microphone, or without video, whatever. You can just listen, you can participate anonymously, you just do whatever you feel comfortable with, and you can talk to other people. Here is the picture from the Dragonfly. So basically this is how our sessions looks like. You can also do scientific related socializing. Again, Dragonfly is an option here, but other options is to talk to your program coordinator, PhD and postdoc reps. They can guide you, or maybe they can help you organize something. Maybe you can have breakfast, tea times, coffee breaks, whatever it is. Another thing is that you should check online, because some key opinion leaders in your field, especially their Twitter is filled with them, most likely organizing some free lectures and seminars online nowadays. So if you want to socialize and continue having some scientific conversations and communications, most of the key opinion leaders are organizing something. Check out, and maybe you can find something else. For me, also volunteering was very rewarding, because I scientifically am participating in a very long-term study. So now it's 4 years, 4th year and counting. And particularly from science, I don't get much of reward. But when I'm volunteering and I do something, now I'm given a lecture, and I'll feel much better that I did something, and I'm telling my brain, hey, you're doing something. So for me, volunteering is really, really beneficial. So you could also join Dragonfly Mental Health or some other thing, whatever you feel like in volunteering. And yeah, it does help. Okay, and more information. Managing your mental health during COVID-19 on Coursera is a wonderful course. I based most of my lecture based on this Coursera. It's for a couple of weeks. It's really, really nice. And the guy who's given the course, he also gives you an examples of guided relaxation, a lot of wonderful things. He also has kids, so he can give this advices on how to manage kids. Very nice. I absolutely recommend it to everyone. Then on mentalhealth.org.uk, they prepared a lot of resources on how to look after mental health during coronavirus outbreaks. Especially, they have also some resources for parents, especially for young adults who are also a very fragile group of people, I would say. They also have some tips on what to do when one can be a domestic violence victim. They have a lot of tips and tricks on a lot of things where to go to in case of domestic violence. So there are also 2 mental health first aid courses, one on Coursera and another one on Johns Hopkins University. Both of them are very nice. And so basically I personally went through Coursera, and half of our other volunteers went through this ones from Johns Hopkins, and also both got very nice reviews. And we would definitely suggest these courses if you want to help others.
Thank you for a fantastic talk, Olga. That was just
Sure.
wonderful. So I hope everyone enjoyed themselves, and we look forward to interacting with you more in the future.